Let's react to some video clips from the internet when it comes to different hair restoration procedures and some of the results that we're seeing.
My client got this hair transplant 6 months ago, and it was a lot worse before.
Okay, so what I'm seeing is this is a patient with advanced hair loss. When you look at the crown area, you can tell how wide it is and how bare it likely was. And I can see some of the transplanted hair that's growing. But most likely, this patient will not get a very full look because when you're starting with a bare area, it takes quite a bit of work to get you to a more full look. And we have a video on advanced hair loss and realistic expectations that people ought to have when going in for a hair transplant when they're starting off quite advanced.
Doctors take hair from the sides and the back and put it on top.
Yeah, and you can see there that he's trying to blend the densities with his clippers between the transplanted zone and the harvested zone. And I think that patients with this type of advanced hair loss can potentially end up happy. They just need to have realistic expectations and they can't expect a very full look. And it usually requires several surgeries to get them to full coverage across all the areas that are bald or very thin.
In time, the hair begins to grow on its own.
Yeah, in terms of the postoperative course, initially the transplanted hair will fall out, and then about 3 to 4 months after, the new hair starts to grow in. And it happens gradually. It takes about 6 months for you to see about 50 to 60% of your result, and about 1 year to see about 95% of the result, and it can take a year and a half to see the final result.
I mistakenly thought that a hair transplant was a one-off thing. The guys who often go for one hair transplant and then getting a second, a third, and even when you're 60, it's going to have gone again.
People definitely go in for multiple hair transplants, and there are different reasons for that. Sometimes it's just because they want a little bit more density in an area that was previously transplanted. Other times it's because there's another large area of thinning, like let's say we work on the frontal scalp with the initial surgery, and now all of this further back, mid-scalp crown, is quite bare, then that will warrant a second surgery to help fill in some of that area. Now, the other thing that could happen is that if people are not on medical therapy and their hair is continuing to fall out, then if you're just relying on hair transplants, you'll of course need multiple surgeries to keep up with the hair loss. And the issue there is that you'll never achieve as good of a result compared to first protecting and preserving your existing hair and then building on top of that with the hair transplant. So medical therapy is extremely important, as I say frequently on this channel, and it complements potential surgical results. So when it comes to medical therapy for hair, make sure to check out feelconfident.com, where you can get your prescription-based hair loss medications, and you can also get things like a thickening shampoo, thickening conditioner that can help the vitality of your hair.
You're going to be left with a strange look, and a lot of guys end up at that stage just shaving your head off anyway.
Right, and if you've had an FUT surgery where you have this linear scar on the back of your head and you're unsatisfied with your transplant results, it becomes difficult to shave your head because people are usually quite self-conscious about that linear scar. So that's one of the reasons why people have moved away from an FUT type of surgery, and now there's more FUE surgery being done for at least male patients. And that at least gives you a fallback option if at the end of all the procedures and at the end of your hair journey, you end up wanting to just shave your head.
Do not make this dangerous mistake with a hair transplant. This is what happens when you don't treat hair loss and just get a surgery instead.
Because I didn't knew what the hair plantation looks like. I just trusted the doctor.
Yeah, so in this case, it looks like they went a bit low on the hairline design, and I think maybe the patient was not on medical therapy, so he probably continued to thin out. So now you have these transplanted hairs that are not at a very high density. Also, that hairline looks a bit artificial to me. I don't think there's enough irregularity or enough single hair grafts. So you couple this low hairline that looks not ideal with the hair further back that's in a completely different pattern. So you haven't really blended the transplanted hair with the original hair pattern, and things just kind of look odd. And if he continues to lose that hair further back, now he has a really low hairline with sparse hair and not much hair elsewhere. So that looks quite unnatural. If they instead went with a more conservative approach to help refine his hairline higher up and working into the sides and into the corners, then he would have had potentially quite a nice result. And also with medical therapy on board, he would have been able to protect his existing hair. And that would have left him with a much better outcome.
Yeah, I said, okay, you guys know better. So I just got my surgery done just a day to have this done, maybe a few hours.
Yeah, and a good hair transplant, especially one that moves about, let's say, 2,000 grafts plus, is going to take a lot more than a few hours. So if you're in a place where in 3 hours they get everything done, most likely that is not a quality place. At a quality transplant center like my own, you should expect to be here with us for anywhere from 8 hours up to 12 hours, getting a transplant done properly with enough breaks to keep everyone happy and moving along, and really with the right proper attention to detail and artistic work that will get you to ultimately a good place for your hair. But again, the medical therapy side is a very important piece of the equation.
So there's also in front of you, but the hairline doesn't look natural. Just after a few years now, I have more hair loss and I wanted to get it repaired and fixed.
Getting that situation repaired and fixed is very challenging, because if we start to remove some of those hairs that are placed quite low, then you start to have scars there that are visible with FUE technique, and you're shifting that back. So the best thing to do is to have your initial first surgery done properly in experienced hands that won't leave you with an issue like this.
Right, ladies and gents, so we've got a client here that's been suffering for 20 years. He had a hair transplant, left him with this.
Yeah, that is not a great result, right? So it's possible that he had the transplant when he still had a lot of his other hair, and they may have not transplanted much, or they may have transplanted from a zone that he ultimately lost, because with FUE surgery especially, some of your harvest zone is going to be where the hair is still DHT sensitive. So you move that hair over and it's still susceptible to loss over time. And also some people just get smaller procedures. So this doesn't look like there was many hairs transplanted. And of course, when you're just left with transplanted hair at the recipient site, usually it's not a very impressive result. It should look a little better than that, of course, but it's still not incredibly impressive. It's always best to protect your existing hair and then build on that with a transplant. I know I sound like a broken record, but I still get patients who reach out to the office. We do these consultations and they don't understand that core type of concept. And that's so important when it comes to hair transplant surgery, especially.
And he's not in a position to shave his scalp because of the FUT scar, so he's got strips.
So again, with FUT surgery, one of the biggest drawbacks is that you basically lose the option of being able to fully shave your head. So while it is a powerful technique and you can harvest many grafts with that technique, and you're getting it from that DHT resistant zone ideally, so those are some of the pros. When someone is susceptible to a Norwood 7 type of situation like this gentleman, it's really prudent to make sure that they're on medical therapy before proceeding to lots of surgery, and especially before proceeding to FUT surgery that will leave them with that linear scar. So I'm not sure where this gentleman started as far as before his surgery, like what was the situation on his head. If he didn't start with much hair at all in this DHT sensitive zone, then after, let's say, a single surgery, I would say this is not a bad result because he has a lot more hair. If he instead started already with a lot of hair in this zone and then he didn't see much gain from the transplant, that's a different story. It looks like he still has a lot of crown exposure, and it looks like there's a lot of see-throughness at the hairline and beyond, and I understand why he would be unhappy. But again, in my experience, a lot of this stuff comes down to setting proper expectations before the surgery so that patients understand what they're in for and what they can realistically expect. Now, I find that some patients don't really necessarily listen well, and they don't necessarily hear me when I tell them exactly what they can expect, or as best as I can predict. But most patients who listen well and understand what the possibility is for their outcome, they're going to usually be quite happy with the result as long as technically the procedure is carried out well. Again, I'm not sure what his starting point was, but at the end of the day, you have a patient who's dissatisfied with their outcome. So it's important to figure out if something went wrong with surgery, or is he maybe continuing to lose a lot of hair because he's not on medical therapy, or the medical therapy isn't working, or is it just a situation where he needs additional surgeries to help build up that density and to help increase coverage in areas that were not worked on initially. So these are FUT scars that I'm seeing here, and there's several of these different scar lines. There's essentially two main ones, and it's possible that one of the scar lines could have been reopened, several times. But now he's left with pretty bad scars, and he's probably not the most comfortable walking around with a shaved head. A lot of people are very self-conscious when it comes to this type of situation, and it doesn't look like he's had the rest of his hair completely recreated with the transplant, so he's kind of left in a bad type of spot. So what are some of the options for a patient like this? Well, sometimes you can do FUE harvesting to help improve the appearance of those scars. Of course, you can occasionally actually cut out the scars and try to resuture, but when there's a lot of tension already there from all of these different FUT procedures, it becomes difficult to really optimize that scar by just cutting it out and resuturing, though that can be a possibility. And then also there's scalp micropigmentation, where little droplets of ink are worked into the scar lines, and that can surely help as well if it's done properly. But it's best to just get the surgeries done well initially. So there's different ways to close a wound, and you want to make sure that your hair surgeon is an experienced surgeon, and ideally also with plastic surgery background, so that they can optimize the actual suturing of your incision to give you the best possible scar, since you're going to have a linear scar from an FUT type of procedure.
Bro, I think I'm losing my new hairline, bro. Look at it when I pull it back, bro. Look at this. Oh my God, look. Look at this, bro. And yeah.
So he's pointing to his transplanted hairline, and what he's seeing is that there are some gaps there. Generally speaking, once the transplanted hair grows in, it's rare for that hair to fall out. It's possible, but assuming this isn't like many, many years after his transplant, it's unlikely that the transplanted hairs are falling out. Either he's experiencing shock loss to the hair that he had in that area previously, like his original hair, or he's just seeing some gaps in the areas that were transplanted. And if he started off with bare scalp, it's pretty normal for there to be a density that's not the original, right? It might be 50% of the original density, maybe 60, maybe 70%, but it's not going to be 100% of original density with a single surgery. So oftentimes patients who are dissatisfied with the density created after an initial transplant will come back in for a secondary procedure. That doesn't mean that the first surgery was a failure. It just means that they want more density. That's very different from the hairline just looking unnatural, or the actual shape or the positioning of the hairline being off. Just needing more density is a pretty normal thing when it comes to hair transplant surgery. So being able to differentiate an outcome based on whether it's a lack of density or other problems related to how the transplant was done is very critical.
I literally just turned up to my appointment. I explained to them exactly what I wanted and what the issue was. The issue was that I'm very uncomfortable with the size of my forehead. So I was under the impression that what I wanted was going to get fixed. Now, they didn't fill any of this in.
When it comes to plastic surgery, including hair transplant surgery, it's not really about fixing things, it's about improving things. So I always correct patients when they say, can you fix this? I can often make things better, but it's not like it's going to be absolutely perfect. Nothing in life is absolutely perfect, including surgery.
Before I got there, they said, oh yes, we can do that. They even drew the outline. I've got the photos. They drew the outline and showed me where all the hair will be filled. I was very happy with that. So I said, yeah, let's do it. Let's do it.
So I'm not sure if she means that they were drawing on her pictures, like after a virtual consultation, let's say, before she even signed up for the procedure, or if she's talking about the drawings that were done right before they started her surgery on, let's say, the day of the procedure when we do the markings. If in fact they did the markings in a certain way and then didn't follow those markings after she approved those markings, then that's not ideal, of course. But if she approved the markings and they followed those markings, then it's hard to come back to the clinic or the surgeon and say, hey, you didn't do the right thing. So we always make sure that patients approve their markings before we proceed to the next step, which is to actually do the surgery. Because there's plenty of surgical elements that have their own challenges and things we can't predict. So at a minimum, we want to make sure that the markings are exactly what the patient wants and what we think will look good for the patient. And also we want to make sure that when we're actually doing the surgery, that we follow those markings as closely as possible.
This side just rounds off. like, what the actual hell?
It's important to keep in mind that the two sides are never going to be exact. The skull is shaped differently in everybody from one side to the other. You can see in this patient's facial anatomy that her left eyebrow looks different from the right eyebrow. It looks a little bit higher. It has a slightly different shape. Even the eye sockets are positioned a bit differently. One side of like her cheek on the left is flatter than the cheek on the right. There are all these differences. So you have to be understanding of that. And we try to point that out to patients, especially when they're, in for surgery. And that will affect how the area is designed and optimized before even, going in and doing the surgery. So again, I understand where she's going with some of these concerns, but I would hope that she had plenty of time on the day of surgery in the morning, let's say, to discuss this with her surgeon and for them to really kind of give her feedback on that. And if what they actually did surgically deviated significantly from what they discussed, then of course that's problematic.
Specifically said, I wanted that covered. 2, the hairline on either side is different. 3, you can see where the hair transplant ends. Look, it's right there. You can see.
Right. So on that note, regarding like the actual density of the hair, when you transplant hair into, again, a bare region, you're going to have density that does not exactly resemble the original hair density. So that thick hair that she has further back, it's very common for the transplanted zone to be less dense. It's actually always the case. It's just a matter of how much less dense. So in this case, maybe she's seeing about 40% density of the original. Maybe if she was seeing 60%, she would have a different opinion on it, but it's not going to be a one-for-one match with that thicker hair further back. In order to get there, she would need a secondary procedure. So what we find with lowering hairlines in women is that we often need to come back into at least the central segment to bolster that density. Usually the sides heal quite well. In her case, again, she didn't like the design of the sides, and that can be adjusted. But as far as the density of the central portion, it's very common to come back in to bolster that density in female hairline lowering. So again, setting expectations so critical for hair transplant surgery. And clearly, the surgical team didn't necessarily do that in her case. And even if they tried to, she had a different set of expectations and ended up unhappy.
You see how sparse it is compared to the rest of my hair. When I put my hair down, you can see it. I expressed all these concerns to them, and they just dismissed everything.
Right, and that's not good. I mean, I think as a patient, you want to be heard. You want to make sure that your surgeon and the clinical team that they work with feels some sense of responsibility, and that they hopefully want to help you improve your situation, even if that means additional surgeries. But my stance on it is, look, I want every one of my patients to have the best possible result. Surgery has some things that are, not fully predictable. And so I need patients to stay realistic about what they're going to get. And I also think that in the recovery process, and if the patient has questions, when they come to the surgeon and they say, hey, I just wanted to know about this or that. Just my recommendation for patients is to not be as accusatory as maybe, some people are. I think it's important to keep an open mind, listen to your surgeon. You picked them in the first place, so hear them out. Hopefully they don't just get defensive, but hopefully they give you like accurate information that you can use then to potentially get a second surgery, or, maybe just wait it out or try something else. The more the conversations can stay open and honest and friendly between the surgical team and the patient, especially in the recovery process, I think the better it is for everyone involved. So trying to, even if you're upset, coming to the doctor and, trying to keep an open mind as to what might be going on. Again, you should assume that the doctor wants the very best for you. So just keep an open mind, try to, have a friendly recourse. And if you're not getting the answers that you're hoping for, then of course seek a second opinion. But try not to come at the doctor, fingers pointing, because most of the time, at least from a surgeon's perspective, we really do want the very best for each and every one of our patients.